Well, if you're a woman, I want you to come closer because this conversation is definitely for us girls. We've all suffered from a urinary tract infection or thrush at some time in our lives. And although it is pretty common, it can be really debilitating. But it is a relief to know that there is something that can be remedied and quickly. We have Mamone Selolo in studio, who is a pharmacist at Medicare, and she'll be giving us some useful advice on how to manage and treat UTIs. We'll also be dealing with family planning issues and contraceptives, so keep watching. Mamone, welcome to the show.
Thank you for having me.
This is one of those, you know, as women, I know that we've all dealt with this. It's not a fun topic, but it is nice to know that there is a way to treat it. But before we chat any further, what exactly is a urinary tract infection?
So a urinary tract infection is a bacterial infection which affects any part of the urinary tract. So it can be the kidneys, or the bladder, or the urethra. It is most common in a lot of women. I think I, for one, I have experienced it in my pregnancy. And it actually has led me into a premature labor.
Wow.
So I gave birth to a 29 weeks old baby because of a UTI. So it is a very serious, and it's the most uncomfortable thing to do, especially in pregnancy.
Yeah.
Because what happens is if you're pregnant, the uterus, as it grows, because it sits directly on top of the bladder, so the bladder then doesn't empty out as it should.
Yes.
So then that remaining urine, that's what causes the infection.
Yeah.
So with the pregnant woman from the Medicare pharmacy side, we will have to do a referral to the video med doctor, who will have to prescribe the antibiotics for the pregnant ladies.
Yeah. What causes a UTI, and how does one even begin to treat it?
It is a bacterial infection.
Yeah.
So what I can advise is ways that we can avoid to not get the UTIs. Is maybe when you go into the bathroom, instead of wiping from the back to the front, you have to wipe from the front to the back.
Yes.
So we have to try and drink a lot of water, because if you are drinking a lot of water, then it at least flushes out all the bacteria as well.
Yeah.
So those are some of the things. I mean, especially the wiping. It's not even a lot of people that know that. It's very important how you actually wipe.
Yeah.
Because remember, if you're wiping from the back, that is a bacteria that will go straight into the vaginal tract.
And steps to treat it once you have it?
So once you have it, the best way to treat it is with antibiotics. So we do have a video med consultation in our Medicare pharmacies. So the doctors are always available to assist with that. So the clinic nurse, which is a professional nurse, will do the test, which is the urine test, to test the urine. So we can give you like the cranberry tablets or your citrus sodas. Those are the kind of front shop things that we can advise to give, because those help with the prevention or the treatment of the urinary tract infections.
Yeah. When it comes to things like family planning, how does Medicare make sure that they join you on that journey to make sure that it is one that is filled with knowledge, and of course you know exactly what you need?
Okay, so with the family planning, because most of the family planning, the contraceptives, it's scheduled medication.
Yes.
So obviously the member will come in and we will do a referral to the professional nurse as the procedure. So the nurse will do a few checks, because there is factors that affect, you know, the type of contraceptive. So it's not every woman that gets the same or reacts the same to the contraceptives. So there's different kinds. I mean, there's the oral contraceptives, there's the patch, there's the IUDs. So there's all the different kinds, which the sister will do checks like the BMI, they will do a pregnancy test, maybe if it's the first time. So they look at even the age, because like the women that are over 35, if you're smoking, the lifestyle habits and stuff. So those are the factors that they will consider in the clinic that the Medicare obviously offers. And that will also be a procedure that is done through the video med doctor for a prescription, which will be valid for 6 months.
Yeah.
And that is only at a cost of $175.
Yeah, so basically Medicare is with you every step of the way.
So Medicare is a one-stop shop. You literally go in and you get the pharmacist, who will do a referral to the professional nurse, she is very well equipped to do all the examinations that are necessary. and the video med doctor is immediately available to assist with the prescription. So
wow, it's like having all the experts on speed dial.
So it's like having everyone in one circle.
Yeah.
And I mean, there's also the front shop element of it, where you get the healthcare professionals in the front shop that are also there to assist.
Sure. I can feel the entire country just have a sigh of relief at knowing that that service is available. Well, there you go. To all the ladies out there, you can know that Medicare is your one-stop shop for all of your healthcare needs, from family planning to urinary tract infections. Medicare's family and professional staff are there to help and advise you on all your personal hygiene and wellness matters. Medicare, reinventing pharmacy for you.